Hi, my name is Cherise Fretwell. I'm a certified nurse midwife and a family nurse practitioner at Alabama Regional Medical Services, and I've been working here for 2 years.
All right, Ms. Fretwell, would you have any general women's wellness tips for viewers?
Just in general, I recommend that women really try to take care of themselves and pay attention to their weight and what they're eating, and making sure you're coming into your doctor for regular checkups.
Okay, what about women from 20 to 30?
20 to 30 is really important that you're coming in and just putting yourself in the optimal health state. At that time, you're young, you might not be paying attention to what's going on with your health, and that you just come in for your regular checkups. Women who are sexually active need to be tested regularly for sexually transmitted diseases, and just make sure that you're paying attention to anything that's going on with your body, and you come in and talk with that with your health provider.
Okay, what about prenatal care? What does that entail?
Prenatal care is a very extensive visit. We recommend women come in for preconceptual counseling. That is, that you want to talk to your provider before you get pregnant, when you're thinking about getting pregnant, that you want to come in and make sure that your body is in its optimal health state. So we recommend that you come in and then we talk to you about what your goals are, that you're taking, maybe starting to take prenatal vitamins, that we're checking your blood pressure, checking your weight, checking out your diet, and to make sure that your body is healthy to be able to maintain a pregnancy.
What about women 40 to 60 years old? What do you kind of look for in your checkups?
Women that are 40 to 60, we start looking at you getting your mammograms. You want to come in and get your mammograms at least every 2 years at 40. Yearly, you want to come in and make sure that we're doing a breast exam, you're doing your own monthly breast exams, that you're getting your pelvic exam. Your pap smear is scheduled every 3 years and at times every 5 years. And then we're also looking at other screening tests, such as for colon cancer at 50, and then a little further on, we're looking at your bone density test around 65. So you want to make sure that you're coming in and following your provider's recommendations in terms of how you're coming in and getting your screening and taking care of yourself.
How do you like to stay healthy?
I like to stay healthy. Personally, I try to watch my diet as best as I can. I kind of follow like a 90-10% rule where I'm eating healthy 90% of the time, and maybe 10% of the time I'm, indulging on things I like. I also try to exercise 3 to 4 times a week. I like to run, I do yoga, I go to the YMCA, I like to take walks, and just try to stay as physically fit as I can, and to be that example to my patients, and not just preach, but actually be an example in terms of how to live healthy.
Excellent. Now, what made you want to work in women's wellness?
I love women's health. I love taking care of women and making sure that, I'm doing everything I can to make sure that they are taking care of themselves and they have the knowledge that they need to take care of themselves and be, women is usually the backbone of the family, and they want to make, oftentimes they're not taking care of themselves and putting themselves last. So I want to be that person to support them and to make sure they know what they need to do, and to let them know that it's okay to put themselves first at times so that they can take care of their families.
Excellent. How might patients or potential patients find you? What days do you work and what location?
I work Monday through Friday here at the Plaza location, and on Friday mornings I'm actually at our downtown location that's off of 25th Street.
Excellent. Thank you so much, Ms. Fretwell.
You're welcome.